there, I'm Alicia Willoughby, and I'm an orthopedic and women's health physical therapist, and I am here with Sarah Bradford, who is the owner and founder of the Luma Method. And today we are going to do a diastasis assessment on a postpartum mom.
So for those of you that aren't familiar with what diastasis is, it's commonly referred to as an abdominal separation. However, it actually kind of goes beyond that. So rather than just being a separation of the muscles, it's really a stretching of the connective tissues between the muscles. And so that can happen during pregnancy, and postpartum it doesn't always come back together. So we're going to show you how to look for that and essentially what you want to do to start to rehabilitate.
Okay, so the first thing I'm going to do is have her do some movements with her legs and her upper body to check how she can transfer the load through the midline. So the first thing I'm going to have you do is lift up your left leg. I'm looking right through here, and I don't see any doming. Come back down, and then the other side. So there's some shifting of her pelvis and back down, but no doming through here, which is great. So we know that when she does that motion, she's able to stabilize. Then I'm going to have you lift one leg up and hold it up. Now she's going to lift up the other leg. And here's where we're going to see that doming happen there. And come back down, and you'll do that one more time. So one leg up. She does okay with one leg, and then that minute that she goes to lift that second leg, it feels soft through here, and there's that dome. And come back down. And then I'm going to have you curl up like you're doing a little crunch, and then same thing. We're going to see this dome right through here and back down. Good. So that dome is there because her six-pack muscle is still in a separated position, and the connective tissue through the midline can't hold back the pressure through her midline. So when she comes up, that pressure is coming out through that stretched out connective tissue through there. So the next thing I do is I just come through and I start feeling her tissue. So I'm trying to get an idea, a sense of what the genetic makeup of her tissue is. How elastic is it? How much recoil is there? What I find in a lot of women that end up with a larger diastasis is that they don't have as much elasticity through their tissue, so they end up with some of this looseness in the fascia. And then I will come through and feel the muscles on the sides. How much tightness is there in here? How much does the six-pack muscle move? How much do the obliques move? In pregnancy, when that six-pack muscle separates, a lot of these muscles get retracted back into the waistline. So I'll find that a lot of women have a lot of tightness in through here that needs to be released in order for that diastasis to come back together. Okay, so then we're going to come in and look more specifically at the size of the separation here. So the first thing I do is just palpate the left and the right side. I try to find the sides of that muscle belly. So here I'm holding on to her right side, and then there I'm holding on to her left side. So I'm holding on, this is the right side of her six-pack muscle is here, and the right side of her six-pack muscle is here. So you can see the size of the separation in the middle here, and this is when she is at rest. So with my fingers, that would be about 4 finger wide in the middle. We're also going to check what it's like up at the top. It's a little bit more narrow here at the top, and then down here at the bottom, and it's also going to get more narrow here at the bottom. So her shape in rest goes about like this. Next thing I'm going to do is I'm going to check the size of it actively. So I'm going to hold my fingers in the middle. I'm going to have her do a little crunch and lift up. And here, now the separation is 2 fingers in the middle. So this is her active measurement, and then relax back down, and then it widens back to 4. So I would say she's 4 at rest, and then curl back up, and then 2 active. And again, I would check the active, say up for a second. Yeah, she's 2 up at the top here, and then 1 at the bottom. Good, and come back down. So that gives you the size of the gap there. Then we want to check how is the muscle tension. So the first thing I would do is ask her to engage her core, whatever that means for her. So go ahead and engage your core. You don't need to lift your head up. Just do a core contraction lying down here. Good. So I see a little bit of push out or bulge here, but what I do feel, which is really good, is some nice tightness here. So relax. Good. So it's soft here, and then go ahead and engage her core. She's already done some of this work, so she knows how to do it correctly. And I feel the deeper structures engaging here. So I want to make sure that that a mama can engage her deep abdominals here, not just her six pack. Good, and relax. And then I'm gonna come back down into the middle, and now I'm feeling for what does the depth feel like. So when she's at rest, I can get my fingers pretty deep into her abdomen, but I do feel there is a floor there. It doesn't feel like I could just keep going any deeper than this. So it's deep, but it's not as deep as it could be. And then I'm gonna have her engage her core, keep your head down, and engage your core. Good, and now I'm feeling the same thing. What does that depth feel like? And for her, that the depth of the gap comes up a little bit when she engages, which tells me that when she engages her deep core correctly and with really good breath control, she's getting some muscle generation through her whole midline and through that diastasis. Good, relax. And so her real goals for healing this diastasis is to continue to build the muscle generation within the middle of her separation here. Not all separations are going to come back together. We like them to come closer together, but not all of them are. And so what we really want is for her to build that muscle strength in through the deeper structures. Now I am going to teach her how to assess her own diastasis, so that if you're wondering what's going on with your belly, you can check it out. So the first thing I'm going to have her do is she's going to do a mini crunch, and then she's going to use her fingers in this orientation and feel down the midline of her belly. And at every place, you're going to get a feel for where is the left side and where is the right side of my muscles. And you're looking for depth, you're looking for size. Can I fit one finger in there? Can I fit two fingers? It's most common to be widest at the belly button because the belly button is there. Good. And then come on down. And the next thing I'm going to have her do is she's going to come up again into that position. And then I want you to just lay your hand here and just get a sense for the shape of your belly. Can you feel that bulge in the middle? Can you feel that coning or that tenting that's happening above the belly button? Good. So it's important to note that when you measure yourself, when you lift up, you're just getting that active measurement. So many women, for her, she would say, oh, my diastasis is 2 fingers. But then what we found earlier is that at rest is actually 4 fingers. So it's important that you check yourself, but then if you think if you feel something going on, then you come to somebody to get a more thorough assessment so you can get the whole picture.
So we hope that you found this helpful, and whether you are 6 weeks or 6+ years postpartum, it's never too late to start to heal yourself from a diastasis. So if you think that you might have something going on, definitely check yourself at home and then reach out to a women's health physical therapist or a professional that can really do a thorough assessment on you and start to give you the tools to properly re-strengthen and heal your core.
And then it's also really important that when you do get back to exercise, if you're already back to exercise, that you do it in a way that is safe, in a way that's actually going to help you heal your postpartum abdominals versus keeping a diastasis around longer or causing some more dysfunction through the midline. So here in Marin, we're really lucky to have the Luna method, and it's a really nice, safe way to get in a really good exercise class in a safe way that's going to help your abdominal muscles heal.